I'm Bill Adams, and I'm a member of the ICSI Patient Advisory Council. A few years ago, I started having problems with atrial fib. So of course I began with my own physician, and I have an excellent relationship with him. We respect each other. He gives me information, he gives me his opinion, and then together we make a decision that seems right for me. So we decided to manage my atrial fib in various ways, and that worked for a while. And then eventually we decided that I should see a specialist. And I went to a specialist of my own choosing, not necessarily the one that he recommended. And that experience didn't work out so well for me. They gave me information and told me what to do, and for me, what I need from a physician is for them to give me information and to give me their opinion of what I should do, and then together we can make a decision that seems right for me. So I went to the specialist that my doctor had originally wanted me to go to, and that experience was excellent. That physician gave me information, we talked about the various options, and he respected my opinion. It seemed like what he wanted was for my best interests. And we decided to, rather than do a procedure, to manage my atrial fib by changing medications, and that worked for a while. And then eventually I went back to my primary care physician, and we decided it was time to do something different. I went back to that specialist, and again he treated me with respect. We talked about the things, my options. I wasn't sure at that point that I really wanted to go through with it, but you know, he answered all my questions, he allayed my fears. And so when we made the decision to do the procedure, it seemed like the right decision. I wasn't sure after I got into the hospital system whether that was the right decision, because he had treated me as a person and not a patient, and all at once I found myself being treated as a patient and not a person. I felt like I needed to conform to the hospital system, and that increased my anxiety because I was concerned that if they didn't respect my opinions and wishes at this point, that if I got into a situation where it was going to be much more important for them to hear my opinion and wishes than what was going to happen. But I reminded myself that I had really excellent physician care, that I experienced really good decision making with him. So while my shared decision making wasn't the best with the hospital, it was really excellent with the physician. And the bottom line is, and the good news is, that the procedure worked.